Hello everyone. So after a brief pause, I think we have taken time to again repost. So sorry for the delay. And today we'll cover a very basic thing in the laboratory services, that is identification of error and troubleshooting in medical testing laboratory. Whenever you do some job, there is always a chance of error because everything cannot be given a guarantee of 100%. So therefore, you can at any point of time do some error. So the main importance of the medical testing laboratory is just to uh, identify the error and therefore to start the and to troubleshoot so that the error does not appear or does not happen. So therefore, this starts with this topic, and when I'm saying that this identification of error, so therefore we start with the first topic is the what is the importance of this error. So when I'm saying that I'm even 99% correct, it may sound that we are pretty good. 99% correction means only 1% error in our job. So let's see what medical industry, leave medical industry and all other industries, how 1% error can look like. So the 1% error in France, it looks like 14 minutes without water or electricity, 50,000 persons lost by postal services, 22 newborns falling from midwives' hands, 6 lakhs lunches contaminated by bacteria, and 3 bad landings in early airports. So you can understand what is the importance of even 1% failure. So therefore, our whenever you go for doing some medical testing, you need to be absolute error free. But the main problem is that we don't sometimes try to accept it. So whenever if you ask anybody what time you have made some mistake, so you may have a tall claim that mistakes are very rare in lab. I think we have no mistakes actually. Last mistakes done in 1989 or something. So therefore, it is the acceptance of a mistake is sometimes very difficult thing to do. And therefore, when you start accepting mistakes, there is the chance develops of improvement. So you must have some process, must have some system in your job atmosphere that will be able to identify your errors so that you should not come across to the error aiming to the patient report, because we cannot afford even 1% error in our patient reports. So that is why this all the things, all the discussions are going on. So why do laboratory errors occur? So that occurs mostly because of poor sample control, poor result verification, quality control is not up to the mark, case you are using non-validated or sometimes unverified also. Time pressure is a very important thing. Sometimes in a hurry, you always do mistakes. So therefore, time pressure is important. Poor workload management. So that is an important thing. Most of the cases, we always try to do the job without adequate manpower. So therefore, the understaffing is another important thing. And lastly, inadequate attention to the details. So whenever you're doing hurry, when you are understaffed, that is the detail, either all the attention paying to the detailed steps of the procedures sometimes get missed, and there is lying the potential trap for development error. Error has got a big uh, definition. So whatever it may be, the definition is definition, but error means when you are not doing something right or expected, no, which is expected to be right. So therefore, we'll go with these errors and its types. So in a laboratory, the errors are divided into 3 sections. One is a pre-analytical error, means the error has happened much before the analytical process of the main testing process is even carried out. So that is called pre-analytical. Starts from patient preparation, patient identification, and also on. The most important thing is that out of all errors, 46 to 68% of the errors, that means as big as more than two-thirds errors, are happening in the pre-analytical region only. Then only 7 to 13% are analytical errors, and The 19 to 47% range is a post-analytical error. That means when an error happens even after the test is done. So therefore, this most important thing is pre-analytical error, because that is the major source of error in your testing entire system or the process. So some of the examples of this, some pre-analytical errors like inappropriate test request, order entry, patient misidentification, sample collected from infusion route. These are all pre-analytical errors, even or more specifically pre-analytical errors. Sometimes there are different problems in sorting. Patient sample sorting, pipetting, centrifugation can lead to pre-analytical error. Analytical error when there is equipment malfunction or sample mix-ups. Post-analytical, there are lots of things can be reporting problem, turnaround time delayed, the delay in critical result interpretation, they all come under post-analytical error. Therefore, the laboratory tests which are influenced by when you are working in a laboratory, the tests are influenced by the laboratory environment for sure. Then knowledgeable staff is very important to have a competent or knowledgeable staff. Reagent and equipment has to be good quality. Sometimes you do compromise with that. That happens very badly on that. Then quality control. But the QC must be perfect. Communications between the staff, communication between patient and doctors has to be very good in that case. Process management has to be good. And the records, that's a very, very important thing. Record does not only gives a document a record of this test, but also it is one of the major data from where you can analyze your fault and you can correct. Suppose one blood collection, a very simple process of a blood collection that can lead to so many faults, so many errors, like failure to draw blood. Sometimes patient has a vasovagal attack and faint during the blood collection. You may double puncture create hematoma, maybe edema. Excess obesity may cause a difficulty. When there is IV line therapy is going on, you are always having a chance of contamination. Sometimes the patient is so dehydrated, the hemo concentration may lead to problem. Sometimes in old age, you will find the rolling veins, very hard rolling veins, which collapses or slips out. And lastly, sometimes your faulty blood technique can lead to some process called hemolysis, the rupture of RBC that turns the serum red, and therefore lots of problems, lots of interference can happen for it. So even a simple blood connection can lead to so hell-like complications. Not talking of hemolysis, we are discussing about it. So if the hemolysis is there, that means if the RBC is broken during the process, so there are lots of time it can have happen. After drawing the blood, you are shaking the blood too much. That can cause RBC to rise. Or sometimes the commonest thing is that you are drawing the blood in a syringe, and without opening the needle, you are pushing the syringe into the vacuum or into the container. So during the high speed flow of the blood through the narrow syringe, sometimes cause a turbulent flow in the RBCs and can cause rupture of RBCs. So that can lead to hemolysis. Hemolysis is very difficult. Sometimes because of its color, it creates interference in some tests. Sometimes also, it might so happen that the parameters like potassium, AST or LDH, they are very highly concentrated in RBC. So when RBC is rise, they come out in the serum. So they may cause an abrupt rise of these parameters. So this happens because of hemolysis. So hemolysis is one of the reason why we reject the samples, not testing the samples for sample results. Similarly, if you don't treat the patient properly, patient is not in a proper fasting condition, you may get a thick chylomicron in the serum, giving a turbid appearance of the serum. So that is called lipemia. It also interferes lots of tests, particularly of electrolyte, sodium and potassium. They get affected by the lipemia very badly. So therefore, proper patient preparation before taking a blood is also very, very much essential. Now we come for the analytical error. That error happens during the analytical phase. That means during the assay period, when the test done by the instruments or by the manual testing whatsoever. So there are two kind of error. One is a random error and one is a systemic error. So what is called by a random error? Random error means that error happen all of a sudden, and there is no definite reason found in this. Maybe as such a reason that this error may or may not be repeated in future. So there is no guarantee that this will not repeated again. Either there is no guarantee that it's not going to be repeated again. So random error is sudden unexpected deviation of the test result. But whereas systemic error is something different. Systemic error means some error which is present in your system. So, if you don't change the error or you don't correct the error, the system will not be free of fault. So, the error will keep on repeating one after another. So, systemic error means there may be certain things which is inbound in the system which is affecting the result. Until unless you change it, the error will persist and the same error will keep on repeating. So, there are certain random errors, certain voltage difference. All of a sudden, there is a pipetting error by your very experienced technician, or sometimes there is such pitch quality of error has suddenly deteriorated. So these things can do some random error. So, but it's not in the part of the system. It's a purely operated error. That means during the operation, there was a sudden error has happened. But systemic error means you have a problem in the system, like your reagent has degraded, your reagent has come down, so the sensitivity has gone down. Until and unless you change the reagent as a whole, the same problem will keep on repeating. Like you have a calibration error. So until unless you do the recalibration, calibrate the instrument again, because of this faulty calibration, the same kind of error will keep on repeating. So therefore, to find out the systemic error and to what are the roles of systemic error, we have got Wizard rules, which will be the first thing is a Levy-Jennings chart formation, and then maintenance of SGARD rules, multi QC rule policies. With all these things, I'm not going to tell in detail because the QC part will be dealt separately. It's a very vast and big part, cannot accumulate all of a sudden. But just this slide is given for your knowledge that we also identify the systemic errors in our lab with the help of this LJ chart and also proficiency testings. Now comes the post-analytical errors. The post-analytical errors are long tat. Sometimes in manual transcription, you may have an error, improper data entry, delay in critical alert reporting. This is one of the things I would like to emphasize more on. What is critical alert? There are certain parameters which results are very critical for our body. So until unless you intimate the result to the concerned person, to the concerned physician or the patient party, the treatment may be delayed. So critical alert means the parameter results are so dangerous for life, immediate attention and treatment is mandatory. So those parameters we call as a critical alert. Suppose one of the example I'm giving. So potassium is, a patient has got a potassium 8. So this is, you have done with the best of your machines, the perfect result. But it was not reported immediately. You reported it in the next day morning. The sample has tested in the night. When in the morning you reported the report, by the time patient has died of cardiac arrest. And then this is a wrong report, because a report is meant to help the patient to treat the cause and treat the effect. Now you have done enough delay. By this time this cardiac arrest has happened, and so your result may be give some value to the patient autopsy, not for a patient diagnosis and treatment. In that case, however good your report is, end of the day, it does not serve its purpose, so it's a wrong report. That is a critical alert has to be reported very urgently, and it has to be given topmost priority because it can save the patient's life. Now, after talking so much negative, let's go some positive. How do we achieve excellent performance in laboratory? So you have to taken care of these errors that can happen. Now you are taking steps so that this error should not happen or do not happen. So how do you achieve that? So therefore, first thing, you have to give a proper sample collection. Now I'm giving you the picture. How many faults you can find in this picture? So many. First of all, this is not the right one. You should use a proper tourniquet because it may cause muscle degradation, increase calcium level. Angulation is very improper of this FUTMM. And there are a lot other mistakes I can find out. So let's not go into details, but you can see a proper sample collection is also very important for a proper sample test result. That can lead to muscle degradation, sudden increase of calcium level, hemolysis, improper continence maybe. Sometimes you are drawing your blood in, suppose if you are drawing calcium sample in EDTA, the result will become 0 because EDTA will chillate on the calcium. Wrong timing, very important. I told about lipemia, that wrong timing or sample contamination. These are the things which has to be taken care of during sample collection. Now, therefore, when something out of control, you have not found the process to be proper, what you have to do? First, you check your internal quality control data to find whether there is a problem with precision and ECAS to find whether there is a problem in accuracy. We'll deal later on. Precision is repeatability of test and accuracy is how close you are to true value. So, on the basis of the two inputs, you analyze the problem, you identify the error, and after identification of the error, take a proper remedial action. So that is called corrective action. Only corrective action will do? No. You have to take such an action so that this should not recur again. So you have to do kappa, that means corrective action, as well as you'd have to take a preventive action. Corrective action to correct this problem, preventive action to ensure that this problem will not happen again. Whenever you're talking about an equipment, these things you must look at. Proper acquisition, installation has to be good, and all the method has to be validated. Daily and monthly maintenance and calibration to be given topmost priority. Proper repair and service records. These are very, very important things for an instrument to operate properly. Now, process control, how you do the process control. The first steps, what I told you, is a quality control. Then sample management, method validation and method verification. Validation means when you are doing test in some method has to be validated by a proper validated body. Now verification is what? You are using a validated method, globally accepted method, but you have to see whether it is good for your population under whom you are catering. So therefore, these are the process controls which helps you to do better. Now transcription error and TAT, how to improve. Now automation, in the line of automation, this has got a very good solution. Now you can use your LIS or HIMS, that means Laboratory Information Service or Hospital Information Service. So where the machines automatically throw the results to the system. So therefore, the chance of transcription error or manual error is minimized, and also the time taken from the instrument to note the result from the instrument and typing the error, this part is totally gone with the advent of LIS. Now LIS is not a very rocket science. Now even a smallest laboratory can also afford that, and more or less you will find most of the laboratories has been taken some of the softwares in their operation. Now therefore, you have to understand in this process the two things, records and documents. Records are dead thing. Something done, data is recorded. Document is a live thing. Record you cannot change, document you can change and review. So therefore, the records are for collection, review, storage and retention, whereas documents are created, revised and reviewed, and if required, sometimes you can amend also. Laboratory assessment is also plays a very, very important role in your improvement and also stoppage of the error. The internal quality assess, how will assess your performance. Internally, you have a process called internal audit. Somebody internally will look every bit nooks and corners of the process and will find out the errors and take a corrective action. So that is called internal audit. Sometimes you do audit review with your management and find out certain other things which can also be added. And most importantly, on day-to-day basis, quality indicators. I'll have a separate class on quality indicator because this is the upcoming and newest concept. Quality indicators are the things, parameters which are chosen by you in such a way that it indicates the performance of your laboratory. So quality indicator is an internal assessment tool of your lab. And external, there is a proficiency testing. That means some external agency will send you some testing material and you will analyze and give the test result to them. You are blind about the result. So they will pull from other peer group results, will compare your result with the peer groups of persons and will send you a score on that basis so that you can understand your position, that how much you are actually close to the true value, or how much in relation to the other peer group labs, what is your stand. Sometimes inspections and sometimes accreditation or assessment during audit, they also find the loopholes from your system, put in front of you. You take a corrective action so that that part is sealed. That weak area, lacunae of your system can be sealed. So, if the laboratory assessment is a very important thing, first internal, second external, both are very, very important part of your system. Now, after finding out the faults and everything, there is a chance of process improvement. So, you want to improve. So, until unless you find all the faulty areas of your part and seal it, how will you improve? So, that is why you have to find out the opportunities of improvement first, and how you can get some stakeholder feedback, patient feedback, complaints. Here, the very important thing. Once you take the problem as a complaint, solve the problem, that means you are one step ahead or one step better than your previous functioning. Some risk assessment. So you have to find out certain areas. So where the chance of error or the error impact of error is very high. So risk assessment means those who have a high chance of error or a very grave impact of the error, you have to take the primary uh, a priority. You have to take it in a priority to seal that area first. So that is why you have to go for risk assessment. So once you have done all these things, you have found your faults. Now take a corrective action, then take a preventive action. Again, I am describing corrective action means solve the process. Preventive action means to ensure that this again should not be repeated. And if repeated, taken care of the action.